So, still a bit itchy. I had burning pain and whatever because I was trying to drive without using my headrest, and I overdid it. Did like 6 hours, and then I've been hurting for like a week and a half. Just feels so stupid. I mean, I didn't feel bad while I was doing it, So I was like, I should know better. So I'm like, well, I'll just keep it to like an hour every other day driving, so I can do that with like Lyft or like DoorDash or something until I could find a desk job, which are pretty much impossible to get. I mean, every desk job I see on LinkedIn is like 100 applicants, and nobody wants a guy with a gap in his resume. So, and a former injury. So, it's pretty much impossible to get a job, a regular one. And driving just takes it out of me. So I think it's the ligaments and tendons that are just not. I guess the muscles too. You use your head more, your muscles more when you're driving because your head's bouncing around. So like laying against the headrest. Like I got a special headrest, so it's comfortable, and on Amazon. And but my neck is still. It was hurting, and it's going to that kind of like muscle and tendon repair where it's like just itches. It's like if you've ever had like sore muscles, like run a long distance or something, and then you're sore, and then you stop being, and it just like itches like inside your thigh or whatever. It's like that, but in my neck all the time, itching. And my neck's been getting tired more quickly in the last week because I think there's just a lot of tissue damage. I don't think it's anything I can't recover from, but it's just like, it's like if you work out hard and you have sore muscles, it's damaged. If you try to work out the next day while you're really sore, you're not going to do much because your sore muscles they can't do much. So, yeah, and I'm trying to save up money for like PRP, prolotherapy, that kind of stuff. Like there's a guy locally, well in Cincinnati, I think, that does it. It's like posterior image guided PRP for like $1,000, which is pretty low price. So I could get the specs I saw from Dr. Papas, or when I saw him, he injected ligaments in my neck, and I could just be like, hey, can you inject these? Make sure you get these. And then if you want to do anything on top of that, great. I really wish I could see Dr. Papas because like he actually knows what he's doing. Like he could tell you every ligament he's injecting into. He can tell just by the feel of the injection whether or not they're damaged. And the PRP hydrogenics is more concentrated, so it's probably equivalent to like 2 or 3 of the injections at the place in Cincinnati. I don't know why. I mean, why doesn't everybody just concentrate the platelets like up to 10 times or whatever? That should just be standard. I mean, it's not like we're limited by technology. It's not expensive to do that. So I don't understand. And I can't get any doctors to talk if I'm like, hey, doc, they're doing this better than you. Can you talk to them? Like, nope. I refuse. Or like if they say they will, the other doctor will be like, no, I'm not telling them. And it's like, you guys are all jerks. Like they want so much respect, but they act like jerks. It's insane. I mean, I could understand if like patients were scarce, but every regenerative therapy place has like an endless supply of patients if they're good. Maybe if they're just starting out, I don't know. But yeah, so that's what I'm doing. I'm just trying to get through the day and be upright as much of it as I can. But if I get tired, I'm resting, and I still have what was I gonna say? I went to see a neurosurgeon about the internal jugular veins, and he was like, "Yeah, I don't think it's because of like the transverse process here, C1." Like, I'm like, "No, it is. Like, I've had 2 interventional radiologists and multiple neurosurgeons confirm, like, on the catheter venograms, like, they couldn't even force fluid down the right side of my right internal jugular vein. It wasn't physically possible to get fluid in there. So that's why they were like, it's not possible to do a stent. If you can't get a liquid in, you're not going to get a solid in. And a stent isn't just a millimeter. It's like several millimeters wide. So yeah, you're not going to do that without tearing the vein. As far as I understand it, unless this guy is doing something magical I don't know of. But the vein's already like absolutely tight around the transverse process, and blood does not flow through it. So I don't know why after all this time of being stretched, it doesn't, get a little looser. Like you'd think the vein would just get longer because it keeps getting pulled on. But I don't know, I guess that doesn't happen with veins, or it's not getting pulled on the right way. Yeah, it doesn't make any sense to me. But anyway, so I was asking online, these people were saying Dr. Constantino is someone like Dr. Fargan. I read his reviews, and there's people were saying like his staff just like do not give a crap about you. So he's like one of those offices where like you like he gets popular and he's so in demand that the whole front office staff gets like a god complex and just treats you like dirt, and they just don't give a crap at all because they're like, where else are you gonna go? And they just do not give a crap about you. Like you could die in front of them and they would laugh. Like they don't care about humans. And so I'm like, yeah, I'd rather not deal with that. So Dr. Constantino was another guy. They were like, it does C1 resections through the side of the neck. I was concerned, like Dr. Lowe in New York said he would, he was supposed to do the surgery on me, but then he was like, well, I don't want to make you unstable. I'm like, I'm reading through all the literature, and I'm like, and talking to people online, and I'm like, I can't find it. There's like one person I found that ever got an unstable, but that was with Dr. Bolognese. Went in through the back of their neck, cut a bunch of like soft tissue, and then resection cut a piece off the transverse process that was blocking the internal jugular vein. And then this person becomes more unstable, and it's like, yeah, I mean, Dr. Bolognese is a doctor who should know better. Like he does craniocervical fusions for people with ligament damage. So he's in there damaging the ligaments. Like, they're unstable now. How did that happen? But he's like, he wants to go in through the back of the neck as opposed to the side, because in the back, I guess if you go in the back and then this is what I'm guessing. I don't know. But if you go in through the back and you cut the bone, you're going to get some scar tissue. If you go in through the side or the front, that scar tissue is going to be around where the transverse process, like where the internal jugular vein was or is. And now maybe you remove the bone, but now there's scar tissue there, so you're still getting blockage in there. So, but and I guess going through the back, you're not entering the space of the internal jugular vein at any point. I don't know. That's my best guess, is just to reduce the scar tissue. But it's insane to cut through the back of the neck and go, because then if you cut in like behind the SCM here and go straight in and hit the transverse process, I mean, I figure you could make a small incision, and I don't know. I mean, the incision's like 4 inches. They like cut you open, like on the side of your neck, like that long to get in. So I don't know. But the people who get it done on the side, I've never seen them say they're more stable. The person that was unstable, at least Dr. Bolognese gave them a craniocervical fusion, and they're doing fine. So I'm still working on cervical curve correction, but it's like, I don't know. I've made a lot of progress with it. Like you can see on my X-ray, like I'm like 50% improved. Like I had no curve, now I've got like in between like no curve and a perfect curve. So it's like somewhat of a curve. And I still have tinnitus. Like if I lay down on my right side, tinnitus gets worse there. Lay on my left, worse there. Lay on my back, both get like medium worse. I don't know about laying on my front. Laying down at all, it just seems like worse blood flow because gravity isn't helping. But it's also like how I hold my head. Like if I'm like this, then they'll get pinched off. But if I'm like this, laying down, then they don't they don't get compressed very much. And I can lay here without like tremendous screaming noises. So, um, and then also I try to, if I'm sitting at my desk, I try to get up every hour at least and let the veins drain properly because it's not quite as good as when I'm standing. So that also helps keep the pressure down, keep new collateral veins from developing. I also don't like try to lean forward like that with my hand because I'm like pulling the head forward, which is like further pinching off the veins. Um, and right now I got like this hum that happens randomly when blood makes it through the collateral vein on this side. At least I think that's what's happening. I mean, maybe it's when it's like, just the shape of the. I mean, if I pinch off the veins, like if I compress them like that and they're pretty much closed, then I start hearing all the whistles and humming and stuff like that. So it's like the blood's making all this sound. It's really annoying. I also got like this deep rumble in my left ear, which sounds like a car engine. Um, but it's strange. It's only my left ear, and it's only if it's dead quiet, it'll turn on, and if it's like if there's noise, it'll turn off. But I mean, like, I'm not talking about I can't hear it anymore if there's noise. I'm talking about the sound literally shuts off. So like completely shuts off. So like I can tell like the sound won't be that loud to where it could even drown out the noise I'm hearing in my left ear, and it just cuts off. And then um, when whatever ambient noise stops, there'll be like silence for 10 seconds, like dead silence, and then boom, it like turns back on. And I have this like vibrating sensation like in my ear. So I don't know if it's like I looked it up on AI and it was like said something about a tensor tympani muscle or something like that, and caused by like extreme stress, being in fight or flight, stuff like that. And I notice like if I'm around other people and I'm more relaxed, I'm having a good time, my neck's not bothering me, stuff like that, like then it barely happens. But also like the tinnitus is a lot quieter too, so I'm like, is it related to blood flow? I mean, it's like worse if I go like this and down like that. It'll just come on, even if it's silent like here, it'll just boom and it just starts up. So I'm like, I don't know if something on this side, like if I have like a tight SCM here, I don't know. I don't know what's causing it. Um, but it's very annoying and stressful. And like sometimes when I can't hear tinnitus and I can't hear that buzzing, it's like I'm so not stressed. Like it's unbelievable, like how much stress I'm just like in all the time, and then when I don't have that, it's like, oh yeah, I remember this. This is what it feels like to feel normal. Like you're just okay. It's like existing, and you're not in constant suffering. So, but anyway, Constantino and I forget Dr. Constantino. He's an otolaryngologist. Um, and so I called his office and they said they were going to call me. And the person that answered the phone when I said, and I heard he was good with internal jugular vein stuff in the neck, they said, yeah, he is. So I was like, oh, the front desk people actually understand what the doctor does. So that's good. That means if I have questions, they can answer. Unlike the guy I saw locally, I'm like, so is he familiar with like C1 resections, or what's he gonna do if he can't stent? Like I call, and I'm asking the nurse this about the procedure I'm supposed to have, and she's like, I don't know. And I'm like, that's it. Just I don't know. Not like I'll find out. Just I don't know. Yeah. Oh well. I don't know. It's like if you're in the medical field, you're supposed to find out, if at all possible, if a patient has a question. If you don't know, find out. if this doctor can't help, then your office's responsibility is to find someone that can. I mean, you at least try. It's not guaranteed to succeed. Anyway, so I don't know. I'm supposed to go in through like a, it's sort of like a catheter venogram, but he's doing it up. He's not doing it on my groin. He's doing it on my wrist and going up there and checking the veins out. And I guess he doesn't need the camera thing, because if you do the camera thing attachment, then you have to go up through the groin, I think, because it's the veins in your arm that go up and around are not big enough, I don't think. But I guess he's just shooting dye down there and watching on the x-ray or whatever. So he'll find the same thing and probably just be like, oh, can't do a stent. Oh well. And just leave me hanging. Never mind that I just asked on an internet forum. I'm like, all right, guys, who does this? And they're like, Dr. Constantino. I'm like, cool. And if I ask my doctor, I'm like, so what's up? Like, how do we deal with this? I don't know. Yeah, and you want me to treat you like you're a god walking amongst men? You're literally literal embodiment of Jesus Christ on earth because you went to school forever. I mean, these guys go to school forever. Neurosurgeons are crazy. So I mean, I do respect them for that, but it's also like, oh man, like you can't send an email to somebody, like you can't ask, or you can't talk to people, you can't ask fellow neurosurgeons, like if you ask a friend, a neurosurgeon who's a friend, it's just like, hey, I got this patient, hey, and he's got this problem, can you at least ask two people, sort of like chainmail this thing, just because like it's a rare thing, I don't know how to deal with it, and he needs help. And if I'll write it down, future reference who to refer him to, but I just can't find anybody. And I don't know. They're either lazy or they're not allowed to do it. Because maybe they don't want to refer to people out of network because they want the money. I don't know. But I mean, I'm not going to go back to them. So I don't, it's weird. But anyway, I'm going to go see Dr. Constantino. And then see, hopefully he can just, because I'm like, if we can just get rid of the transverse processes, screw them, they're stupid. I mean, what's stupid really is the vein, the internal jugular vein going around right next to them. Like no other, there's like all around the neck, like either the veins are farther enough away, they're not affected by the vertebrae, or they're inside the vertebrae. So it doesn't matter which way your neck goes, you know what I mean? Like the having them go down the front like that is like, and they're right in between your styloid and your transverse process, so it's like they get pinched like in between, and it's like, I mean, if there was ever an argument against intelligent design, it'd be that. I mean, it's horrible. So if I could get those things removed or whatever, just I need the problem dealt with, because it's so annoying. Like I can't relax when I lay down. I can't relax in a quiet room. I can't focus. Getting to sleep every night's hard. Getting back to sleep when you wake up, and it's just every day of my life is hard. And that's just because the internal jugular veins. Never mind, not being able to hold my head up because of my muscles or whatever. So, and my, I'm still strong. Like, I can do 7.5 pounds easy, like on side to side, 15 pounds, like on the flexion extension. And my neck's got a lot of endurance, and with that, so I'm like, I got to do that more, and then, go to the gym, and do that. Going to the gym never hurt me. It was just the driving. Driving unsupported was what was causing me. It was just too much. It was too much bouncing around. The tendons were not used to that. The ligaments not used to that. The muscles weren't used to it. It was just too much, too fast. So like, I think if I ease into it, like driving, like, like an hour every other day, and then just work up a little bit and use the headrest, then I just won't get injured. And eventually I can get to the point where I can drive for hours, and I can work on doing like, a few minutes a day, work up to like, half hour a day, unsupported driving. So just like slowly over time, the whole process, instead of like doing what I did. So, God. Another day of suffering.